Hi, I'm Dr. Ian Johnston, continuing our series on playing in the sandbox with Cerner. When I left off at the last video, we had just successfully signed into Cerner, but we had yet to add any patients to the chart. As you'll recall, we were faced with this blank ambulatory organizer without any patients in it. There are many ways to populate your chart with patients. If you have an individual patient in mind, which will often be the case when you receive a referral, it's a simple matter of placing the name up here, last name first, and pressing search. That would be too easy, and also we don't have any easily identifiable patients at this point, so it's more useful to learn how we are going to set up lists of patients. This is something that all of us will do frequently. So when wanting to develop a patient list, it seems reasonable to locate the patient list icon, which we see up here. Alternatively, we could look at to view and go to patient list from there. Most of us will just reach for the icon, and away we will go. Now we see patient list, which doesn't look much different. First step in creating a list is to press on this little wrench icon in the top left corner. We'll click on that, and once again we see absolutely nothing. No available lists, no active lists. But first we have to create an available list, so we will press new, and we have some options. There are many ways to proceed here. Commonly, one may choose a list based on location. I'm a pediatrician, so perhaps I would choose to add all the patients in the pediatric ward and all the patients in the nursery to my list. Another way that I could do it would be by provider group. I could say, please include all patients who currently have a pediatrician as the most responsible physician to my list, because we cover each other on the weekend. Or we could do it by relationship. I could say, let's put on my list everyone who I am consulting on. All of those are reasonable options. We have to start somewhere. We'll go by location. So we'll click on location and press next. Now, there are a number of steps here. It's really quite straightforward as long as you proceed in a logical fashion. We want to go by location. We look at the locations and expand that. We say, okay, we work at CKHA, let's expand that. There we go. Do we work in Chatham or Wallaceburg? I work in Chatham, so we'll expand that. And now we have a long list of all the different areas of the hospital. For convenience sake, I think I will choose Medicine 1, click, and click next. Press finish, and we see available list Medicine 1. Now, a logical person would think now that we're done. In fact, we are not yet done. We have to make the available list an active list. So we'll click on Medicine 1, we'll move it across to the active list box, we'll press OK, and voila, we suddenly have a large number of patients. Now, there's no reason we can't have more than one list. Perhaps I also want to see people that I'm consulting on. So I will go back. I will press the little wrench icon again. I say, yes, I want to have a new list. This time I want it based on relationships. and the type of relationship I'm interested in. There are many, but I want all the ones where I am the consulting physician. Click Next, Finish, and again, it's an available list. It is not active, but we'll move it across to the active list. Okay, now we have two lists. We can see under consulting physician we have nothing because I am not consulting on anyone right now. But in the future, any patient that I accept as a consulting physician will appear on this list. This seems complicated. In fact, it is a little bit complicated. Fortunately for everyone, your real list will be set up for you at Favorites Fair. Favorites Fair is extremely important. This is a opportunity for each of you to sit down with a E-Volve person to lay out your personalized lists, to lay out any of your favorite medications. Those of you who are keen will have an opportunity to lay out dot phrases and other templates and macros. It's a very important half hour or hour, and I strongly encourage all of you to take advantage of it. In any event, we now have completed our list and we have many people to choose from. If we look, we have some which are called CKHA class, some that are called CKHA practice. Now, this is important because the class patients are going to be used during training sessions. So we request that you avoid any patient with the name class in it. If you want to practice, choose a practice patient. Double click. I'm going to assign a relationship and I'm going to call myself a consulting physician. Okay. And there we go. We now have our very first patient chart that is open and ready for us to work on. And how to proceed from there will be the topic of our next video.